As some questions are starting to trickle in here, Joel, one question I had for you, something you mentioned. You mentioned or affiliating with a network is a great way to get an introduction to employee lives. Can you talk a little bit about if there are DPC doctors out there who want to participate in a network, what's required from them outside of just providing exceptional patient care to join the Strata network?
Wow. So let me list it all in order of importance. Be a great doc. That's it. I mean, we have a kind of a care plan model that we want you to follow, and care plan is probably the wrong way to say it, but it's really about, hey, we want to make sure they get in for an annual exam. We want to make sure that you're available to them to answer questions on spruce and those kinds of things. And as I mentioned in my talk earlier today, that doesn't mean that somebody should feel like they need to answer refill questions in the middle of the night, right? If it's in the middle of the night, it's an urgent issue. But no, it's as simple as giving us a call and letting us know you're interested in being an affiliate. We don't charge for any of those affiliate things. And our goal then is to go help you build network in your city and try and help you tackle some of your big employer groups. You know, I let Ryne join in with me to speak today because, once again, you can see how well he does that, right? So I think the other message there is don't try to be everything. It's important to be a great doc. That's all we're going to ask of you. And I think it's much easier if we start to network together and we bring our teams together, and that's how we go get business.
Awesome. And it looks like Dr. Sun working with any physicians in California.
We presently do not have any affiliates in California, but would be more than happy to explore. Right now, the states that we would be in would be Michigan, Wisconsin, Nebraska, Iowa, Kansas, Colorado, Washington, D.C., Florida. I think that's about it right now.
What do you do about the fact that DPCs may have plans that vary by clinic?
Meaning their membership tiers different, or they offer different services?
Oh, sure. Yeah, go ahead. Do you want it, Lisa?
No, right?
Go ahead. Ryne.
Oh, sure. Yeah. So we recognize that, DPC physicians are some may offer x-rays, some may do in-house prescriptions. And so we never want to dictate what you do inside your clinic, especially with your own retail type patients. We have a very simple standard set of services that we would say, at a very minimum, we want you to be able to do this, because what we have found in talking with employer groups is that it's important to them that their employees across a region at least have a minimum level of direct primary care that's consistent. Now, if some clinics offer x-rays and others don't, and that's just a benefit to some of those people that are there, that's cool. But when we contract with that clinic or with that employer group, we at least want to tell them that, their preventative exams are covered, acute visits are covered, and things like that. And you could probably speak more to exactly what's covered in there.
Yeah, and I think the other part is when we find an office that has radiology equipment and is interested in using it, we develop a cash price model with them also and have our other clinics sending them there for x-rays to try and help them build their business. Remember, I see this, and the whole reason I wanted to get involved in direct primary care is it is truly a saving grace for primary care physicians. It's a way to deliver fantastic care, but to me, that's the side product. The main thing about direct primary care is it is here to help save primary care.
Awesome. And then another question here, do you have to be an MD to participate in the Strata network as a affiliate?
No, we have some nurse practitioners, physician's assistants, so no.
Kendrick asks, what do the affiliate agreements look like? Lisa, you want to just comment on that?
Sure.
So Lisa Fisher is with us also. Lisa runs all of our operations for Strata.
Hi, so essentially our affiliate agreements just outline the fact that you are not employed by Strata. It talks about what services are going to be rendered to the members, kind of like what Ryne mentioned. It's not a situation where you have to change much in how you do your own business. It's just from a legal perspective to keep us from having to pay your taxes or you pay ours. If you're interested, we'd be happy to send you one to look at, and you can ask us questions after you have a chance to review.
Any exclusivity clauses in your agreement?
No, we don't have exclusivity clauses.
We just think that we would be the only ones you'd want to work with. And I probably
Awesome.
could
You want to go to Jonathan?
Jonathan, I have 2 physicians in Oklahoma in separate communities wanting to transition to direct primary care. While I don't care to own them, would this be the best opportunity to create an affiliate network even before the employers come to us? Well, it can be very helpful because, once again, it's almost like if an employer comes to you, they are looking for the solution, and oftentimes they're on a very fine timeline to convert for the next year. If you don't have your ducks in a row when they come to you, they're going to be, okay, well, we'll come back next year then. Thanks, and then get that all set up, and then we'll come back next year. And you lost that opportunity. Now, if you think that's happening and somebody comes to you and you're not ready yet, I think the other thing that's really important is be prepared to offer them a pilot. Pilots are a great introductive way into direct primary care. It's great because then you can create the messaging unit inside that employer group when you go to convert them on a whole. So a majority of the businesses, that's not true. Many of the businesses that we've worked with, we try to get pilots in the first.
Let's see. And I guess I want to comment one thing on that, Jonathan, is that we have found that we always talk about the chicken and the egg in direct primary care. You can't get employer groups without a clinic, and you can't get a clinic a lot of times unless you've got demand for them to start up. We tend to think you've got to have a clinic first because it creates a lot more credibility when you go and you talk with the C-suite. And so we've got this clinic established. And so even starting off as a hybrid clinic where you're still doing some fee-for-service and growing direct primary care on the side, is a great way to put up your shingle as, hey, I'm here to grow and help attract maybe some other hybrid clinics around or pure direct primary cares to service employer groups. Grace asks, Dr. Bessmer, what do you think about remote patient monitoring coupled with telemedicine?
It actually can be helpful. I mean, once again, I'm such a relationship individual that I think the relationship is very important. But telemedicine is really what I do every day. It's just I do it with my phone, right? So I'm doing that every day with my patients, and it can be very helpful. We right now are looking as a part of COVID at a telemonitoring company and incorporating it as a part of COVID. But in the big picture, what we're trying to put together there is wellness part of it and those kinds of other things. So when COVID goes away, the monitoring needs to continue and the employees want to continue with it. So I do think that there's some value in that space.
We had a question asking if Strada and Nextera are in the same space.
Hey, Clint and I love each other. I'd like to think we're married, but we each have wives. Yes, we are partners and work together in every way. So we would love to talk with anybody about affiliation.
Clint asks if we would explain a little bit about what we do for our affiliates.
Oh, well, that's a great question. So from that standpoint, I'll let Lisa talk a little bit on the operations side, but one of the things we do in the very beginning is just if they haven't been a DPC provider, first of all, if you're a DPC provider out there and you're listening right now and you wonder what Strata is going to do if you affiliate with you, we're going to try and send you business, right? I'm not going to come in and try and teach you how to practice direct primary care. But if you're a doc who's just now converting, let me tell you, it's a little different. Right? It's so there are some things that we're going to go through and talk about how it's different, why it's different, how I want you to do this, that, or another from that standpoint. And it's not about how you practice medicine. It's more about the delivery model. Direct primary care is a different delivery model. And what I'm going to try and do is teach you not to practice ass and seat medicine. And I know that sounds simple, but I think you'd be surprised at how difficult the transition can be. Lisa, you want to talk a little bit about it?
Sure. So essentially what we do is we try to take care of all the back end. So we have the relationships with the technology vendors, Hint, Spruce, the data reporting through KPI, and we get the patients, we send them to you, and then we just ask that you take great care of them.
Develop cash pricing, probably.
Yeah, develop cash pricing. We collect the money. Essentially what you get is a list of patients that you take care of. We buy the technology and ask you to take care of them. We collect money, we pay you directly. We do the marketing, the reach out, we educate employer groups, we educate employees. Our main line answers any customer questions there might be about direct primary care. We just try to make it as easy as it can be for you to do direct primary care without the back end work.
Yeah, I'm sure many primary care providers are suffering in the face of COVID. It's a hell of a time to grow direct primary care because many of the providers are trying to figure out how to practice telemedicine, right? And yet it's what we do every day. So there was no group better positioned to deal with COVID than those practicing concierge medicine, direct primary care, and those things.
Ross, what's up? Ross has a question. So Ross and I have met virtually a few times talking about what he's doing in his graduate school program. And he has a question about what are the differences between Strata and Nextera's MSO type models versus Evermed and others. And I don't know that I don't know that I understand Evermed's model enough to answer that question.
I certainly don't.
Lisa, do you have any comments on that? Okay, sorry, Ross. We can maybe follow up with you on that. If you are new to DPC, do you see a problem accepting Medicare patients?
Well, if
Lisa, why don't you take that one? Yeah.
Are you planning on opting out of Medicare or staying in Medicare becomes the real first decision point?
Right, it depends. If you're going to be seeing Medicare patients anywhere, even if you're moonlighting someplace, you should not be seeing them in direct primary care because Medicare doesn't like that. You need to opt out. So if you're pure DPC and you're opting out of Medicare, then you definitely can see Medicare patients. There's just a lot of steps that you need to follow to opt out.
Yeah, and once again, that's really, it's a deeper question than the time allows. I'd be more than happy to chat with you on the side. Feel free to give Strata Healthcare a call or send me an email, joel@stratahealthcare.com, and I'm happy to reach back out to you because I would want to make sure you understand what it means to opt out because it's not easy to get back in.
Cole asks, are you looking to expand outside of the states listed on your website? And I would say, depending on the state, for sure, we don't want to expand too quickly to where we can't service employer groups or affiliates that we bring on. But if you're interested in what Strata's doing and if we could help support you, that would be great. I mean, an example is we recently expanded up into the northern Wisconsin area. And after expanding, and this was a pure direct primary care practice that said, we really don't want to have to deal with employer contracts. We'll run our retail DPC, but anyone that's interested in employers, we're just going to send them to Strata and have you guys run it. And we've been able to help them onboard groups and have really good success there. So whether you're new to DPC altogether or you're in a solo practice and working with employer groups and doing the analytics and doing the reporting and account management, just sounds like a lot of headache. I think that's where some of our value add may come in. And we're certainly interested in expanding just given the opportunity in more detail. We can still keep our own branding if we work with one of these networks. Absolutely, with Strata, you can keep your own branding. Clint, thanks for chiming in on all this. This is great.
You're doing fabulous, Clint.
What's the cost to be an affiliate with Strata?
Oh, so get your checkbook out. It's big, $0. But I won't make you write me that check for that. No, we don't charge for affiliation. Once again, this is about growing the direct primary care network. If we're affiliating with you, it usually means we've got work for you in your community, or it's a community we really want to get into because we know employers have talked to us about it. So if anybody's interested, just reach out to us in Strata Healthcare and we'd be happy to let you know. But it's not a cost.
I saw Clint said 0 with 2 exclamation points. We had a question up here. Ben's asking, can you share how our structured payment works with the employer? So let's say we sign on an employer with one of these practices. What goes to Strata? What goes to this practice?
Oh, okay. So Strata keeps roughly 25%. In the big picture is how that works. And so some of it depends on how big the employer group is. And some of it can also be, if you come to us with the employer group and you've done a lot of the work, then sometimes that percentage is open for discussion. But that's the plan otherwise. You get 75% for the care.
We had a question if we could help in Indiana. We actually just had an employer group reach out from Northwest Indiana about getting coverage there. So absolutely, if you go to our website and just submit something to us or shoot us an email, we'd love to work with you. Oh, let's see. I've done a lot of DPC pricing research and have noticed that practice websites sometimes list prices that are different than what appear on the MSO websites. Does the price to a patient differ if they find a DPC directly, or are they connected through the affiliate network?
So that's a great question. I've never been asked that before, but so many times when we're working directly with an already established DPC practice and they have their pricing structure set and their patients enrolled, we don't make them go in and adjust that. Once again, our goal is going to be, we're coming into that community to go get the employer groups, and we have set pricing for employer groups. But the beauty of that is we're going to take care of that, and we're going to send you a check for that, and you'd continue to bill for your own patients at the pricing of what your clinic structure is. So there could be times when there are two different pricing structures in there, but it's not that it's complicated to run. And let me tell you, it's especially not complicated to run because of Hint. And the only reason I can do all that is because of Hint.
And the way that you would sell that to the employer group and the conversations we have is, let's say a DPC that's in our network is retailly priced at like $65
to know if you work for
$65 or $70, and we might be at $99. We'll typically tell that employer group that what you're getting for that extra fee coming through Strata is all the money that we've invested into our affiliate network, all the knowledge base, the reporting, the analytics, the extra team that you get for it. And we have not run into that being too much of an issue. Does the 25% include the hint cost? Yes, it does.
Once again, and I think on top of that, what I want you to make sure that you would understand, as an affiliate, when we talk about utilizing Spruce, Hint, any of those tools that we want you to use to be the successful direct primary care doc we want you to be, that's covered in our cost, right? So the collecting of the fees and setting everything up with the businesses and getting the contracts and doing all that, that's all on us. The Spruce is on us, Hint is on us, those kinds of things. But Hint's almost free.
Kendrick asks, if we bring the employer, what benefit do we have involving the network other than the network might help us close the deal for geographies we can't cover? Talk with us about that. I mean, unique deals or some of these deals are just unique. I mean, if we have a DPC doctor that brings us an employer group and they truly just need our back end infrastructure, we can work out that deal separately. But most of the time, it's Strata sourcing these employer groups. So Kendrick, if you want to talk offline about that, more than happy to do that.
Just want to emphasize what Clint dropped into the chat, that these physician-owned led networks are so very important to the DPC movement. I couldn't agree more. Just watching you guys help the community grow is just phenomenal, and it's been exciting to be a part of. So thank you so much for what you're doing.